In 1961, doctors across Europe began noticing something terrifying. Babies were being born with catastrophic deformities at rates never seen before. Arms that ended at the shoulder, legs that were just stumps, hands growing directly from the torso like flippers, internal organs on the outside of their bodies, eyes, ears, and vital organs missing or malformed. Within months, thousands of infants had been born with these horrific birth defects. Parents were devastated. Doctors were baffled. No one could explain why this epidemic of deformities was suddenly occurring in previously healthy families across multiple countries simultaneously. The answer, when it finally emerged, was even more horrifying than the mystery itself. These babies had been poisoned. Deliberately and knowingly poisoned by a pharmaceutical company that marketed a morning sickness drug, despite having evidence it caused exactly these birth defects. A company that buried test results, silenced doctors who raised alarms, and prioritized profits over the lives of thousands of children. This is the story of thalidomide, the scandal that destroyed 10,000 babies, and the pharmaceutical corporation that got away with mass murder. In 1957, a German pharmaceutical company called Grünenthal introduced a new drug to the market, thalidomide. They marketed it as a revolutionary sedative that was completely safe, non-addictive, and impossible to overdose on. The company's advertising claimed it was so harmless that even children and pregnant women could take it without risk. Thalidomide was sold under different brand names in different countries: Contergan in Germany, Distaval in the United Kingdom, Kevadon in Canada, dozens of other names across 46 countries worldwide. But the promise was always the same: safe, effective relief from insomnia, anxiety, and morning sickness. The drug became wildly popular, particularly among pregnant women suffering from nausea and vomiting. Doctors prescribed it freely, reassured by Grünenthal's marketing materials that emphasized its safety profile. Pharmacists sold it over the counter in many countries, requiring no prescription at all. Pregnant women took it daily, believing they were protecting their health and their baby's development. Grünenthal's profits soared. By 1960, thalidomide was one of the best-selling pharmaceuticals in Europe. The company expanded aggressively into new markets, pushing for approval in the United States and other countries. Their sales representatives visited doctors' offices with free samples and glossy brochures, promising miraculous results with zero risks. But there was a problem, a catastrophic problem that Grünenthal knew about from the very beginning. Thalidomide wasn't safe, it wasn't harmless, and it definitely wasn't appropriate for pregnant women. The company's own internal testing had revealed serious concerns. Animal studies showed that thalidomide caused nerve damage. Early human trials reported side effects, including severe peripheral neuropathy, numbness, and tingling in extremities. Some test subjects developed permanent nerve damage that left them partially paralyzed. Grünenthal ignored these warning signs. They didn't conduct adequate safety testing. They didn't study the drug's effects on pregnancy or fetal development. They didn't wait for long-term safety data. Instead, they rushed thalidomide to market, motivated purely by profit and confident they could suppress any evidence of harm. The pharmaceutical industry in the 1950s operated with almost no oversight. There were minimal regulations governing drug testing and approval. Companies weren't required to prove their products were safe before selling them to the public. Post-market surveillance was virtually non-existent. Grünenthal exploited this regulatory vacuum to market a drug they knew was dangerous. Within months of thalidomide's release, doctors began reporting unusual side effects. Patients complained of numbness, tingling, and pain in their hands and feet. Some developed permanent nerve damage after taking the drug for just weeks. Grünenthal's response was predictable and ruthless. They denied the connection. They claimed the nerve damage was coincidental. They threatened legal action against doctors who publicly questioned thalidomide's safety. The company deployed a sophisticated disinformation campaign. They published fraudulent studies claiming thalidomide was safe. They paid doctors to write favorable reviews. They suppressed negative reports by threatening to pull advertising from medical journals that published criticism. They had pharmaceutical representatives personally visit doctors who raised concerns, pressuring them to stay silent. This pattern of deception and intimidation would define Grünenthal's behavior for years. Even as the evidence of harm mounted, the company consistently chose profit over safety, lies over truth, and corporate interests over human lives. In late 1959, a German pediatrician named Wedekind Lenz began noticing something deeply disturbing. He was seeing babies born with a rare condition called phocomelia. The term comes from Greek words meaning seal limb, because affected infants had flipper-like appendages instead of normal arms and legs. Phocomelia was extraordinarily rare. Medical literature documented only a handful of cases in history. It was so uncommon that most doctors went their entire careers without seeing a single case. Yet suddenly, Lenz was seeing multiple cases every month. Something had changed. Something was causing an epidemic of a birth defect that had previously been almost unknown. By mid-1960, hospitals across Germany were reporting similar patterns. Babies were being born with arms that ended at the shoulder socket, legs that were just short stumps, hands growing directly from the torso, like seal flippers. The deformities were severe and immediately visible. Parents were devastated. Medical staff were horrified. But phocomelia was only the most visible manifestation of thalidomide's effects. The drug caused a horrifying range of birth defects, depending on exactly when during pregnancy the mother took it. If taken during days 20 to 24 after conception, it destroyed the developing arms. Days 24 to 27, it destroyed the legs. Days 27 to 30, it damaged the hands and feet. Throughout the first trimester, it could damage virtually any developing organ system. Babies were born without ears, without eyes, with hearts outside their chests, with malformed or missing internal organs, with spinal cord defects, with brain damage, with facial deformities so severe they couldn't eat or breathe properly. The full spectrum of thalidomide damage was truly nightmarish. Many babies died within hours or days of birth. Their deformities were incompatible with life. They suffocated because their lungs hadn't developed properly. They bled to death because their hearts were malformed. They died from infections because their immune systems were compromised. Thousands of affected babies never survived their first week. Those who survived faced lives of extreme disability. Children with no arms learned to eat, write, and perform daily tasks with their feet. Those with flipper hands developed remarkable dexterity with their limited appendages. But many tasks were impossible. Many required lifelong assistance. Many faced constant pain from their malformations. The psychological trauma on families was immeasurable. Parents who had taken what they believed was a safe medication watched their children suffer because of that choice. Mothers blamed themselves. Fathers struggled with guilt and grief. Siblings grew up watching their brothers and sisters face daily challenges that shouldn't have existed. By 1961, the pattern was undeniable. Hospitals across Germany, the United Kingdom, Australia, Canada, and dozens of other countries were reporting epidemic levels of severe birth defects. Doctors began sharing information and realized they were all seeing the same thing. The coincidence was impossible. Something was causing this catastrophe. Dr. Wedekind Lenz in Germany and Dr. William McBride in Australia independently began investigating. They interviewed mothers of affected babies, looking for common factors. They reviewed prenatal care records. They analyzed the timing of exposures, and they found the smoking gun. Nearly every mother of a severely deformed baby had taken thalidomide during early pregnancy. Lenz presented his findings to Grünenthal in November 1961. He had documented dozens of cases with clear correlation between thalidomide exposure and birth defects. He urged the company to immediately withdraw the drug from the market. Grünenthal's response was to attack him personally. They claimed his research was flawed. They threatened him with lawsuits. They pressured medical journals not to publish his findings. But the evidence was overwhelming. Other doctors confirmed Lenz's findings. The British Medical Journal published case reports. Australian researchers documented the same pattern. The correlation was mathematically certain. Thalidomide was destroying babies. In November 1961, Grünenthal finally withdrew thalidomide from the German market. But they did so without admitting fault. They claimed the withdrawal was precautionary and maintained that no definitive link to birth defects had been proven. They continued selling existing inventory, They didn't issue recalls. They didn't warn pregnant women who had already taken the drug. They protected their profits until the very last moment. Other countries followed slowly. The UK withdrew it in December 1961. Canada in March 1962. Some countries continued allowing sales even longer. By the time thalidomide was finally removed from worldwide markets, the damage had been done. An estimated 10,000 to 20,000 babies had been born with severe thalidomide-related birth defects. Thousands more had been miscarried or stillborn due to the drug's effects. As the full scale of the thalidomide disaster became clear, investigators began examining how such a catastrophe could have occurred. What they discovered was a deliberate systematic cover-up that extended from Grünenthal's laboratories to the highest levels of the pharmaceutical industry. Grünenthal had never properly tested thalidomide for safety in pregnancy. This wasn't an oversight, it was a deliberate choice. The company rushed the drug to market knowing they lacked adequate safety data. They marketed it specifically to pregnant women, despite having no evidence it was safe for developing fetuses. Internal company documents, later revealed during lawsuits, showed that Grünenthal scientists had raised concerns about thalidomide's safety as early as 1959. Animal studies had produced troubling results. Rabbits given thalidomide during pregnancy had higher rates of malformed offspring. Rats showed similar problems. The company's own researchers recommended further testing before marketing to pregnant women. Grünenthal executives ignored these recommendations. They buried the animal study results. They didn't include them in the marketing materials. They didn't disclose them to regulatory authorities. They actively concealed evidence that their drug might be dangerous during pregnancy. When doctors began reporting nerve damage in thalidomide patients in 1959 and 1960, Grünenthal launched an aggressive campaign to suppress these reports. They threatened doctors with lawsuits. They contacted medical journals and threatened to pull advertising if they published critical articles. They sent pharmaceutical representatives to personally intimidate physicians who raised safety concerns. The company also manufactured false evidence of safety. They published articles in medical journals claiming thalidomide had been extensively tested and proven safe. These articles were ghostwritten by company employees but published under the names of supposedly independent doctors who had been paid by Grünenthal. The research described in these articles was either fabricated or deliberately misrepresented. Grünenthal's marketing materials explicitly claimed that thalidomide was safe for pregnant women and could be taken throughout pregnancy without risk. These claims were not based on any scientific evidence. They were lies, deliberately told to sell more product. When Dr. Lenz first approached Grünenthal with evidence linking thalidomide to birth defects in 1961, the company's initial response wasn't to investigate or withdraw the drug. It was to attack Lenz personally and professionally. They accused him of incompetence. They claimed his research was biased. They threatened him with legal action. They tried to destroy his reputation to protect their product. Even after Grünenthal withdrew thalidomide from the German market in November 1961, they continued selling it in other countries. They didn't warn international health authorities about the birth defect risk. They continued marketing it as safe. They let babies in other countries continue to be poisoned even after they knew definitively what the drug did. The cover-up extended beyond Grünenthal to the pharmaceutical industry as a whole. Other companies that had licensed thalidomide and sold it under different brand names were slow to act on the evidence. Distillers Company in the UK knew about the German withdrawal in November 1961, but continued selling thalidomide in Britain for another month. Canadian distributors continued sales into 1962. Regulatory authorities were complicit through inaction. Government health agencies in most countries had approved thalidomide with minimal review. They accepted Grünenthal's safety claims without requiring independent verification. They had no systems in place to detect patterns of birth defects. They failed in their fundamental responsibility to protect public health. The medical establishment also bears responsibility. Many doctors prescribed thalidomide freely without questioning the company's safety claims. Medical journals published Grünenthal's fraudulent research without adequate peer review. Professional medical organizations failed to sound alarms, even as evidence mounted. After the scandal broke, Grünenthal fought viciously to avoid accountability. They denied that thalidomide definitively caused birth defects, claiming the correlation might be coincidental. They argued that the drug had been properly tested according to standards of the time. They blamed doctors for prescribing it inappropriately. They blamed pregnant women for taking medication without medical supervision. The company destroyed internal documents that would have revealed the extent of their knowledge about thalidomide's dangers. They paid settlements to some victims on condition they sign non-disclosure agreements and never speak publicly about their cases. They used their wealth and legal resources to delay trials and exhaust victims' families financially. Grünenthal's executives were eventually charged with criminal offenses in Germany. The trial began in 1968 and dragged on for years. The company used every legal tactic to delay proceedings. They challenged evidence. They claimed witnesses were unreliable. They argued that standards for drug testing in the 1950s didn't require the kind of safety studies that would have detected thalidomide's effects. In 1970, the criminal trial ended without convictions. Grünenthal agreed to pay a settlement into a compensation fund for victims. In exchange, criminal charges were dropped. The company never admitted wrongdoing. No executive went to prison. No one was held personally accountable for knowingly marketing a drug that destroyed 10,000 babies. While thousands of babies in Europe, Canada, Australia, and other countries were being poisoned by thalidomide, the United States was largely spared. This wasn't luck. It was the result of one woman's refusal to be bullied by a pharmaceutical company. Dr. Frances Oldfield Kelsey was a medical officer at the U.S. Food and Drug Administration. In 1960, she was assigned to review an application from William S. Merrill Company to market thalidomide in the United States under the brand name Kevidon. The application seemed straightforward. Thalidomide was already being sold successfully in dozens of countries. The pharmaceutical company provided extensive documentation, claiming the drug was safe and effective. They expected routine approval within months. But Kelsey wasn't impressed by the application. She found the safety data inadequate. The studies provided were poorly designed. The company claimed thalidomide was completely safe, but their data didn't actually demonstrate that. Critical safety studies were missing. Long-term effects hadn't been evaluated. Effects on pregnancy hadn't been properly tested. Kelsey requested additional data. The Merrill Company was shocked. No one had ever questioned thalidomide's safety before. They responded with more marketing materials and testimonials from foreign doctors. Kelsey rejected these as insufficient. She wanted actual scientific evidence of safety, not promotional literature. The pharmaceutical company escalated pressure on Kelsey. Company representatives visited her office repeatedly, demanding approval. They contacted her supervisors, complaining about delays. They accused her of being unreasonable and obstructionist. They pointed to thalidomide's worldwide success as proof of safety. They claimed American patients were being denied an effective medication because of one overly cautious bureaucrat. Kelsey refused to be intimidated. She continued demanding adequate safety data. She was particularly concerned about reports from Europe of nerve damage in thalidomide patients. If the drug caused peripheral neuropathy, that suggested it could cross biological barriers in ways that might be dangerous. She wanted studies specifically examining the drug's effects on fetal development. The Merrell Company never provided the data Kelsey requested because those studies didn't exist. Grünenthal had never conducted them. Throughout 1961, as Kelsey continued blocking thalidomide approval, babies in Europe were being born with catastrophic deformities. When news of the European birth defect crisis broke in late 1961, Kelsey's skepticism was vindicated. The drug she had refused to approve was revealed as a mass poisoner of babies. Her careful review process had prevented a catastrophe in the United States. Some American babies were still affected by thalidomide, however. The Merrell Company had distributed thousands of thalidomide tablets to doctors as investigational samples for clinical trials. These trials were conducted with minimal oversight. Pregnant women were given thalidomide without being properly informed it was experimental. An estimated 17 babies in the United States were born with thalidomide-related birth defects from these trial distributions, but it could have been thousands. If Kelsey had approved thalidomide as the pharmaceutical company demanded, morning sickness would have been a major indication. Pregnant women across America would have taken it. The scale of tragedy would have matched or exceeded what occurred in Europe. Kelsey became a national hero. She was awarded the President's Award for Distinguished Federal Civilian Service by President Kennedy in 1962. Her courage in standing up to pharmaceutical industry pressure highlighted the need for stronger drug safety regulations. The thalidomide disaster led directly to major reforms in drug approval processes. In 1962, the U.S. Congress passed the Kefauver-Harris Amendment to the Food, Drug, and Cosmetic Act. This law required pharmaceutical companies to prove drugs were both safe and effective before marketing them. It mandated informed consent for clinical trial participants. It established systems for monitoring adverse effects after drugs were approved. These reforms revolutionized pharmaceutical regulation worldwide. Other countries adopted similar laws. The standards for drug testing and approval were fundamentally strengthened. The idea that companies should prove safety before selling drugs, rather than marketing first and dealing with problems later, became the norm. But these reforms came too late for the 10,000 babies already destroyed by thalidomide. And in many ways, they didn't go far enough. The pharmaceutical industry continued to wield enormous power. Companies continued to suppress negative data, downplay risks, and prioritize profits over safety. Thalidomide was the most visible catastrophe, but the underlying problems in pharmaceutical development and regulation persisted. The children born with thalidomide-related birth defects faced lives of extraordinary challenge. Many had severe physical disabilities that required constant medical intervention, multiple surgeries, prosthetic limbs, specialized equipment, lifelong physical therapy. The medical costs alone were staggering. Beyond the physical challenges were psychological struggles. Growing up visibly different in societies that often treated disability with pity, fear, or revulsion, facing constant stares and questions. Being excluded from normal childhood activities, struggling with self-esteem and identity. Many thalidomide survivors describe the isolation and loneliness of their childhoods. They were often kept out of mainstream schools and placed in institutions or special education programs isolated from their peers. They were treated as medical cases rather than children. Their humanity was obscured by their disabilities. Some survivors developed remarkable adaptability. Those born without arms learned to use their feet with extraordinary dexterity. They learned to write, eat, paint, and perform daily tasks that most people do with hands. Some became artists, creating works with their feet that demonstrated incredible skill. Others became athletes, competing in adapted sports. But this resilience came at enormous cost. The psychological burden of constantly adapting, constantly proving their worth, constantly overcoming society's low expectations was exhausting. Many survivors struggled with depression, anxiety, and trauma throughout their lives. The survivor community has been fighting for justice and recognition for over 60 years. They've organized advocacy groups in multiple countries. They've lobbied governments for adequate compensation. They've shared their stories to ensure thalidomide is never forgotten. In Germany, survivors fought for decades to receive adequate support from Grünenthal. Initial compensation offers were insultingly low. The company fought every increase. It took until 2013, over 50 years after the disaster, for Grünenthal to establish a more substantial compensation fund. Even then, the amounts offered didn't come close to covering the lifetime costs survivors faced. British thalidomide survivors similarly fought for decades against the Distillers Company, which had marketed thalidomide in the UK. They staged protests. They generated media pressure. In 1972, the Sunday Times newspaper published exposés of the company's behavior, leading to public outrage and improved compensation offers. But no amount of money can compensate for a life of disability caused by corporate negligence. No settlement can restore the years lost to pain, surgeries, and limitations. No compensation can give back the childhood experiences stolen by deformity. Many survivors also grapple with aging-related complications. Thalidomide damage wasn't limited to visible deformities. Many survivors have internal organ problems that worsen with age. Many have chronic pain from malformed joints and bones. Many require increasing levels of medical intervention and personal care as they grow older. The thalidomide survivor community continues to advocate not just for themselves, but for stronger pharmaceutical regulation and corporate accountability. They work to ensure that what happened to them never happens again. They challenge pharmaceutical companies when they cut corners on safety testing. They support regulatory reforms that prioritize patient safety over corporate profits. The thalidomide disaster wasn't an accident or an unforeseeable tragedy. It was the inevitable result of a system designed to prioritize pharmaceutical industry profits over human safety. In the 1950s, the pharmaceutical industry operated with almost no meaningful oversight. Companies could market drugs with minimal testing. They weren't required to prove safety before selling to the public. Post-market surveillance was nearly non-existent. Regulatory agencies lacked the resources, authority, or political will to properly police the industry. This regulatory vacuum created perverse incentives. Companies that rushed products to market gained competitive advantages. Those that invested in thorough safety testing incurred costs that reduced profits. The market rewarded recklessness and punished caution. Grünenthal exploited this environment completely. They prioritized speed to market over patient safety. They conducted minimal testing. They ignored warning signs from animal studies and early human trials. They marketed their drug aggressively based on claims they knew weren't supported by evidence. The company also benefited from post-war economic conditions in Germany. The pharmaceutical industry was booming. Companies were developing new drugs rapidly. There was a public enthusiasm for medical progress and miracle drugs. Regulatory scrutiny was minimal. Grünenthal operated in an environment where corporate assertions of safety were rarely challenged. Medical professionals share responsibility for the thalidomide disaster. Doctors prescribed the drug freely without demanding adequate safety evidence. They trusted pharmaceutical company marketing materials rather than requiring independent verification. They failed to report adverse effects systematically. When concerns were raised, many dismissed or ignored them. The medical journal system also failed. Journals published Grünenthal's fraudulent research without adequate peer review. They accepted industry funding and advertising while supposedly maintaining editorial independence. They were slow to publish critical research about thalidomide's dangers even after evidence emerged. Broader society was complicit through its faith in medical authority and pharmaceutical companies. There was widespread belief that modern medicine was inherently progressive and safe. Regulatory agencies were trusted to protect the public. Companies were assumed to act responsibly. This trust was fundamentally misplaced, but it allowed catastrophes like thalidomide to occur. The disaster also reflected deeply inadequate scientific understanding of fetal development and drug effects during pregnancy. In 1957, the field of teratology, the study of birth defects, was still in its infancy. Many doctors believed the placenta acted as a perfect barrier protecting fetuses from drugs taken by mothers. This misconception persisted despite evidence to the contrary. Grünenthal exploited this knowledge gap. They claimed thalidomide couldn't cross the placental barrier, despite having no evidence supporting this claim. They marketed specifically to pregnant women based on a theory they knew was speculative at best. The pharmaceutical industry as a whole resisted reforms even after thalidomide. Companies fought against requirements to prove safety and efficacy. They lobbied against informed consent rules. They opposed post-market surveillance systems. They used their political influence to weaken regulatory proposals. This resistance continues today. Modern pharmaceutical companies spend billions on lobbying and political contributions. They fight against price controls, safety requirements, and transparency mandates. They suppress negative research data. They push drugs onto markets before adequate long-term safety data exists. The fundamental problem thalidomide exposed, the conflict between pharmaceutical profits and patient safety, remains unresolved. Companies are legally required to maximize shareholder value. Safety testing reduces profits. Disclosing risks reduces sales. Corporate incentives systematically push toward hiding dangers and overstating benefits. Regulatory agencies are supposed to counterbalance these incentives, but they remain underfunded and politically vulnerable. Industry lobbying influences regulations. Regulators often come from and return to pharmaceutical industry jobs, creating conflicts of interest. Approval processes remain inadequate in many countries. The thalidomide disaster should have fundamentally reformed pharmaceutical development and regulation. It created some improvements, but the underlying problems persist. Companies still rush drugs to market. They still suppress negative data. They still prioritize profits over safety. The only difference is they've gotten better at hiding it. More than 60 years after thalidomide was finally withdrawn from worldwide markets, justice remains incomplete. Grünenthal never faced meaningful criminal accountability. No executive went to prison. The company paid settlements, but never admitted wrongdoing. They've never apologized adequately to survivors. It wasn't until 2012, 50 years after the disaster, that Grünenthal issued any apology at all. Company CEO Harold Stock gave a speech acknowledging survivors' suffering and expressing regret. But even this apology was carefully worded to avoid admitting legal liability. The company still maintains they acted according to the standards of the time. This is a lie. Even by 1950s standards, Grünenthal's conduct was negligent. They didn't conduct adequate animal testing. They ignored safety signals. They suppressed evidence. They marketed specifically to pregnant women without any pregnancy safety data. These were choices, not inevitable results of historical standards. Survivors continue fighting for adequate compensation. Many are now elderly. They're facing increased medical costs as age compounds their thalidomide-related disabilities. Many lack sufficient financial support for the care they need. The compensations paid decades ago didn't account for lifetime needs. In 2013, Grünenthal established an additional fund providing monthly payments to survivors. But even this came only after intensive lobbying and public pressure. The company had to be forced repeatedly to do anything approaching right by the people they destroyed. The pharmaceutical industry as a whole has never truly reckoned with thalidomide's lessons. Companies continue to engage in behaviors similar to those that caused the disaster. They suppress negative data about drug side effects. They market drugs for uses not proven safe or effective. They influence regulatory processes through lobbying and political pressure. Modern pharmaceutical scandals echo thalidomide. The opioid crisis involved companies deliberately marketing addictive drugs while suppressing evidence of risks. Vioxx X was kept on market despite evidence of heart attack risks. Numerous drugs have been withdrawn after causing deaths that could have been prevented with proper testing. Each scandal follows a similar pattern. Company prioritizes profits over safety. Negative data is suppressed. Marketing claims exceed actual evidence. Regulators fail to properly scrutinize. People are harmed. Company fights liability. Inadequate compensation is eventually paid. No one goes to prison. The system continues unchanged. Thalidomide itself has a strange postscript. The drug was found to be effective for treating certain conditions, particularly leprosy symptoms and multiple myeloma. It's still used today under strict protocols that attempt to prevent pregnancy exposure. But even with modern safeguards, thalidomide continues to cause birth defects in countries where protocols are inadequately enforced. Brazil has seen hundreds of new thalidomide babies born in recent years. Pregnant women with leprosy or other conditions have taken the drug, sometimes without adequate warnings. This proves that even knowing thalidomide's history and mechanism of harm isn't enough if systems don't adequately protect vulnerable populations. The survivors of the 1960s thalidomide disaster are dying. Each year, more pass away. Their stories, their struggles, their fight for justice must not be forgotten, because the conditions that allowed thalidomide to destroy 10,000 babies still exist. Pharmaceutical companies still prioritize profit over safety. Regulators still lack adequate authority and resources. The public still places too much trust in corporate assertions. Until pharmaceutical companies face meaningful accountability, until executives go to prison for knowingly harming patients, until the profit motive is subordinated to human safety, another thalidomide is inevitable. The next disaster might involve a different drug, a different mechanism of harm, a different population of victims. But it will happen because the system that produced thalidomide remains fundamentally unchanged. Thalidomide was marketed for 5 years. It was sold in 46 countries. It poisoned at least 10,000 babies, causing severe birth defects that destroyed their lives. Thousands more died before birth or shortly after. The pharmaceutical company responsible knew their drug was dangerous, buried the evidence, and continued selling it anyway. No one went to prison. No executive faced criminal consequences. The company paid settlements, but never admitted wrongdoing. They waited 50 years before issuing even a limited apology, and the survivors, now elderly, are still fighting for adequate support. This wasn't ancient history. This happened in living memory in developed Western nations with modern medical systems and regulatory agencies. It happened because a pharmaceutical company valued profit more than human life. It happened because regulators failed in their duty to protect the public. It happened because the medical establishment trusted corporate claims without demanding evidence. And it can happen again. The incentives that drove Grünenthal's behavior still exist. Pharmaceutical companies still suppress negative data. They still rush products to market. They still prioritize shareholder value over patient safety. Regulators still lack adequate power to constrain corporate behavior. The thalidomide disaster teaches one fundamental lesson. Never trust pharmaceutical companies to self-regulate. They won't. They can't. The profit motive is too powerful. The temptation to cut corners, to hide risks, to market first and worry about safety later is built into corporate structure. The survivors of thalidomide deserve justice. They deserve adequate lifetime support. They deserve to see the people who destroyed their lives held accountable. They deserve a world where pharmaceutical companies face real consequences for harming patients. Until that happens, until executives go to prison for corporate crimes, until companies are held truly accountable, the pharmaceutical industry will continue producing thalidomide-scale disasters. Different drugs, different victims, same underlying cause. Corporate greed protected by inadequate regulation and lack of accountability. The babies born without limbs in 1961 are elderly now. Many have died. The rest are running out of time. Their fight for justice shouldn't have to continue for 60 years. It shouldn't take lifetimes to force pharmaceutical companies to do right by the people they destroyed. Thalidomide survivors have spent their entire lives living with the consequences of corporate negligence. They've fought for recognition, compensation, and reform. They've shared their stories to warn future generations. They've demanded a system where pharmaceutical companies can't destroy thousands of lives and walk away unpunished. We owe them more than we've delivered. We owe them justice. We owe them accountability. We owe them a system that ensures what happened to them never happens again. Until we provide that, the thalidomide disaster remains an open wound, a reminder that in our system, corporations can commit mass atrocities and escape meaningful consequences. The 10,000 babies destroyed by thalidomide deserved better. They deserved a world where pharmaceutical safety came before profits, where regulators protected patients instead of enabling corporate abuse, where executives who knowingly poisoned children went to prison. They didn't get that world. We still don't have it. And until we do, thalidomide's lessons remain unlearned, and its victims remain unavenged.